Hi, it's Dr. Weiner, and as you see right now, I'm getting blood drawn, and this is for a PRP hair restoration. And what we do is we draw between 60 and 120 cc's of blood, and then we spin it down and we get platelet-rich plasma. And platelet-rich plasma is high in growth factors and growth hormones, so that it stimulates hairs that are resting or shrinking up from aging to begin to stimulate them to produce more hair, to become thicker, and to grow faster. So the process is it's a very involved process. There's several steps. And right now what we're doing is we're drawing the blood. And then what we'll do is we'll throw it into the spinner and the centrifuge. And we have a very special centrifuge. The centrifuge is called Magellan True PRP. And what it does is it concentrates the platelets to 6 times the concentration that we have in our blood. And why that's important is because 6x, or 6 times the concentration, is a key multiple where the PRP is most effective. Keep in mind that most PRP is not that effective. Most PRP is between 2 and 3 times the concentration of platelets in our blood. And that's not really as good as 6. There is some benefit, but 6 is the key, and that's what we get with ours. The other thing we do, and we'll show this later, is that we add A cell. And A cell is a porcine bladder matrix, and that also stimulates stem cells and growth factors within the scalp. So that's added as part of everyone's treatment here at the Aesthetic Clinique, but it's not added at most other people's. So what we'll do first is we'll first draw the blood, then we'll numb up the scalp. We call it a ring block, and we go around the hair, and that creates numbness of the scalp. And then we'll inject the A cell, and then we'll inject the PRP. And then after that, we do a dermapen, which is microneedling, with platelet pore plasma, PPP, which is the byproduct of PRP. And after that, we're done. And so right now we're going to take the PRP and we're going to throw it into the Magellan system. She successfully drew my blood. She was very good, I might add. So right now we're done with the centrifugation, and the machine is spitting out the PRP into this syringe, and there'll be 8 cc's here. And then it's going to alarm us, and that's when we need to change this syringe so that we can get some PPP. So it took around 15 minutes to do, and we're down to about 20 seconds right now. And again, this system does 6 times the concentration of PRP, which is the key number you want to have. So right now what we're doing is we're changing out, and this is just whole blood. That's the red blood cells, which is not useful for us to use, and we throw that part away. And then we'll connect another syringe here, and this will collect the PPP. And then once that is done, we hit the go button, and we get the PPP over here. And then what we'll do is we'll do the same thing over again, because we're doing 2 60cc syringes. Now we're injecting A cell, which is the porcine bladder matrix. We previously have numbed the skin up using a ring block with lidocaine, bicarbonate, and saline. And so this part is absolutely painless, and everything from this point on will be painless. And the ring block actually went very smoothly, and I had hardly any pain with that too. I'm leaning back so I'm not moving when she's injecting. And she's just distributing this into the dermis, in the lower aspect of the dermis. And this is sort of, you can consider it like fertilizer. It's a stimulant for stem cells and for growth factors. And it will make thinner hairs thicker, and it will make dormant cells start to revive, to grow. So this is the second part. After the blood draw and after the ring block, we do the A cell. After this, we're going to do the PRP, and then after that, we're going to do the PPP with the dermapen. So right now, we're going to inject the PRP, which is the platelet-rich plasma. And I haven't felt anything after we've done the numbing. And so, again, we're putting this into the dermis, and it's going to fertilize the hair. Keep in mind that if you are completely bald, it won't work. If the area is shiny and there's actually no hair in the area, this won't work. It's going to work for areas that the hair is very thin or villous, meaning very short and stubby, and recently lost hair. So what can you expect? It's going to take about 4 months for you to start to see the results. The best results come in at around 9 months, and it should last you a year to 16 months. In men, we recommend probably having 2 or 3 of these treatments per year. In women, 1 a year or a year and a half is probably good. Men are much more difficult to treat than women. The very first thing you'll notice is that if you have hair that's falling out, particularly when you're brushing the hair or in the mornings, you'll have a lot less of that. After this procedure, you can expect some minor swelling, sometimes some moderate swelling, and sometimes it even comes into the upper eye area and the forehead. And that's actually a good sign. That means that you're getting a lot of inflammation from the PRP, which is really good. But it shouldn't restrict your activities at all. You should sleep elevated in your bed with like 2 or 3 pillows, because that will help with the edema and the swelling. Also, because we put the PPP on top of the skin, on top of the scalp, we recommend that you don't shower or wash your hair until the morning to let those nutrients soak in as best as possible. I've done this 3 times, maybe 4 times. I've never had to take any pain medications. None of our patients have had to take any pain medications. If you do take blood thinning products like aspirin, Motrin, Aleve, or supplements, we ask you to stop them for at least a week. Aspirin is 2 weeks, because there'll be a little more bleeding associated with that. The other thing we want you to do is make sure you're had a good lunch, breakfast, or early dinner before you have this procedure, and that you're very well hydrated so that we can find your veins. Because we take out a significant amount of blood. We take out 120 cc's. I mean, it's not a lot, but you need to make sure that you're not dehydrated prior to this procedure. So right now she's completing the PRP injection. We have one on the burner, and that should come up in the next 5 minutes or so, and we'll inject a second syringe of PRP. Keep in mind that this Magellan system gives us a very high concentration of platelets, but the other thing is it gives us a lot of PRP. The other systems, they draw 10 cc's and they get 2 cc's. We draw 120 cc's, we get about 16 cc's of the PRP, so we can go a long way. The other areas that this is good for are eyebrows. Okay, if you're missing eyebrows, this is a good area to inject with PRP as well. So we'll cut it here and we'll go back when we do the dermapen with the PPP. We're at the point where we're doing the PPP and the dermapen. The dermapen has microneedles that go 1.5 in this instant millimeters, and they make tiny channels into the scalp, and then the PPP that is placed on top goes through these little channels and helps fertilize the hair as well. This procedure takes approximately 5 to 10 minutes, and it actually has been shown to add